Some have one program in their catchment area. Boston has 5. And so it all depends on, it's mostly population based. Of course, this, thicker um, populated communities are going to have more than one program. And some of the lesser populated may just have the one that covers them.
Pat, I'm sorry to interrupt. We should have been recording this as you were giving us incredibly great information. So I just hit record, and
I heard
and
that.
you'll send me the slides. We'll
I
post them.
will.
So welcome to the recording. Apologize, we missed the first 10 minutes, but we'll have the slides. So thank you.
That's fine. That's fine. So again, early intervention, catchment areas, it's attached to the town where someone lives. Even if your early childhood program is in a different town, you really want to be focusing in on the program where the child resides and family resides. So for those children over too old for early intervention, and I like to suggest that starting at 2 years, 9 months for those children who are not in EI, and want to be referred to the public school for evaluation and eligibility for special education, every district does what's called child find. It's a federally required activity. It's tied to the Individuals with Disabilities Education Act, IDEA, and they will provide routine screenings. You don't need to wait to go to a screening. You can go to the full request for evaluation to determine if the child has a disability and is eligible for special education. This happens to be Boston's webpage, but if there's a term to remember, it's called child find. And early intervention is required to do this as well, to be able to have those opportunities where they publicly advertise for their services. Many websites on district websites will post a calendar. It's a little early for the school year program to be up there, but you can look on any of the public school websites. And so this one's Boston. They do suggest that you go to a welcome center in Boston to be able to fill out the paperwork and get the ball rolling. A parent has to sign a consent form. And so even though a child care provider can do the referral, it's up to the parent to be able to sign the consent. And so you really want to do this in partnership with families.
I have to say, like, you going through the websites and highlighting where I think it's so helpful. So thank you.
Well, you're welcome. You're welcome. And this one's Lowell. And Lowell has a great website as well. They have screening information. They've got their child find. Again, the language to look for is that child find. And know that, again, take advantage of the regularly scheduled screenings. If you're just sort of scratching your head about a child and, and where they are in their development. But if you feel for certain that a child may have a disability, go right to the referral for special education services. And then come to us. We are still, as I said, the federally funded program, a federally funded parent center. And we have an intake form right on our webpage. And, I've highlighted the early childhood, early intervention. You can click that and we will connect you as well. And so it's not part of Family Ties. It's part of the PTI, which is the Parent Training Institute. And we will connect you. So as I said, there are plenty of options available, and I hope that you will work closely with families to make sure that they're getting connected one way or another. And this is just our contact information. I am available to take phone calls. My direct line is right there. I've also included Karen Lopez, who works for the PTI project here. She is our early childhood person, and so she is bilingual, bicultural, and can really be a wonderful asset for all of you to have. You can reach us through the FCSN.org site for family ties. We have a specific one. I'll just shamelessly plug our parent to parent program now. Um, and, and have a web page there. And so I hope that this information has been helpful, and really look forward to answering any questions that you may have. And I will send Amy, I will send you and Titus these slides so you have them.
Wonderful. Thank you so much. So as we said in the beginning of chat, lots of reconnecting. Kim Davenport said that this was a big topic at the Worcester Task Force listening session.
I was there
Um,
as well. Yes.
And Evelyn shares that this is a great resource for families with kiddos with special needs. So no live person answers the ties line, this ties
No, it
line.
never was. It never was. It was always a message machine.
Okay.
And we would call in daily and pick up the messages. I know, like I said, I know that they're still working on doing the translation. Um, and so if you don't hear back from anybody, give us a call. I'm still here.
And then there was a question, if a child lives in Connecticut, but the child currently goes to Mass childcare and parents work in Mass, is it possible that this child has services in Mass?
No, no. Unfortunately, it is tied to the community where the child lives. And Connecticut will have different eligibility criteria for early intervention and for, preschool sped. Massachusetts has a very generous eligibility for
Right,
early intervention. And so it's a challenge. I know we
sure,
we have worked closely with families, not only in Connecticut, but also Rhode Island, all those
right.
border states, and particularly with the military base um, in Rhode Island, and parents living in Massachusetts. And we work out solutions. I mean, if there's a grandparent who can, be there during the day for the child, and bless you, at their home, um, you know, we've worked out visits happening at home.
SY's child find activities need to be all year. This is something that should be addressed. Can't wait 2 to 3 months to get started for the process, nor pause in the summer.
Summer is the biggest challenge there is for
Yeah,
public schools. Those kids with summer birthdays, even if they're in early intervention and get referred, and are found eligible, it's very difficult to keep things going. But every child, when they're discharged from early intervention, should have a transition plan. And in that can be resources around the community and things that are available at Head Start, things that might be available at the YMCA, and community-based activities, which will, continue those learning opportunities for children until school opens up in September. It's one of the biggest disconnects between early intervention and the public school. In that early intervention is a year-round program. They go by calendar days. Schools are school year programs. They go by school days. And so, 45 days means one thing in one arena and something
right.
entirely different in another.
Will Family Ties still publish their fantastic resource guide? Oh,
Yes, we do.
great.
We still have it. It is probably the last year it will be printed. And so you've got my contact information in the slides. I can mail them out. Not a problem. People can stop by our office in Charlestown and pick some up. And we have we had 1,700 printed up this year. And
Okay,
we've probably got 12 cases left. So,
great.
um, yeah, but it
I
will be
see.
always available online. And
Great.
so even if it's not printed again, um, we will have it available online.
And Kim, I see your hand. I'm going to go just finish the chat. Roughly, Don Holly asked, roughly how big do you think the unserved need is? That is, of those who should be referred, how many actually are?
Well, that's that's
That's
the
the question.
$64,000 question.
Yeah.
It's very interesting because I think that the more information, particularly first-time parents get and providers have around the services that are available, the more we can encourage those families to participate. Early intervention after COVID is back now to almost being back to fully staffed. And so, the whole profession took a punch
Right.
with COVID in staffing. And so we're really looking at being able to ramp back up. And we're not there yet. But to be able to provide services in the child care program is also a possibility. And again, it's that partnership within a catchment area.
Yep.
Even if the child lives in Acton, but the program covers Concord and they can, go to the child care program, everything has to sort of stay within that catchment area.
Yeah.
But that's a wonderful because then the staff get an opportunity to observe and carry over those activities, and
Right.
the child gets so much reinforcement within their early childhood program, the way they would at home, but the staff get to reinforce those activities throughout the daily schedule, and it's really a terrific opportunity.
Kim, I'll go to you.
Thanks, Amy. I was just perseverating on this pause, right? So what drives me crazy in our for children here, just in Worcester and Central Mass, but it happens across the state, is this grand pause of like, you've got 45 days of this, but if you have the summer, the transition, or the getting into the public school pipeline for the support evaluation for the services, like those pauses are no good for our children.
No.
They only have 5 years to begin with. And if we're starting at 3, now you have 2, and then you chop it off by another 6 months because of a summer. So I am excited to hear if you or anyone else has ideas, innovations, changes that we should be sharing with this task force, because their pens were up in the Worcester listening session. This is a big issue, and all it does is compound the issue at the school side when the child gets there, because we're not giving the child what they need earlier. So any ideas about how to get rid of this crazy pause or collaborate in a different way to make sure children get what they need sooner and continuously?
Yeah, I mean, I was there. I gave public comment about the need to expand their definition of accessible when they're looking at accessible childcare, because not every childcare program is accessible to a child with a disability. And so we need to do a better job about educate pre-service and in-service to staff, particularly around those kids with challenging behaviors who don't have a diagnosis. And behavior is not a disability. Behavior, in my mind, this is just Pat speaking, is a form of communication. You're not
Mhm.
meeting my needs. And so, we can't change children, but we can change our approaches. And so we really need to be creating environments that, help children feel settled, help children regulate, and to be able to create those opportunities and refer them for special services and so forth. And so again, it's being able to understand what services are available, how you can connect. I mean, it's a lot like emergency preparedness. You want to prepare before you need it. And so
Right.
create those connections with your early intervention programs. Create those connections with the early childhood department at your local public schools. And so that when you do have a child, you've got a relationship. You've got somebody to talk to. You know who the early childhood person is. And, and you can sit on, many of them have advisory councils. Many of them have opportunities just to foster those relationships. And so that as early childhood professionals, you're in the loop. I know I'll just use Framingham as an example. Their Early Childhood Alliance, which is through their CFCE, really connects all of those early childhood professionals within the community, including early intervention, including Head Start. And so you can have these dynamic partnerships that when it comes time to referring a child, you know just who to call, you know just who to connect with. And so, it really is absolutely imperative, really, that these opportunities get fostered, and people change, and you got to do it all again, and so but it's well worth it. And so, and yes, including your family child care providers.
Agree.
They are an integral part of the um, Early Childhood Alliance out in Framingham. But that's one example. You can be talking with any of your CFCEs and the connections that they make. And many of them have partnerships with early intervention who come out and do integrated play groups, because as much as you want inclusion for infants and toddlers, if services are being delivered at the home, and home is considered an inclusive setting. If there are no siblings, if there are no, other children in the family, that child is receiving services in a pretty isolated situation, and,
Right.
and may not get an opportunity to transfer some of what they're learning in a group situation. And so having, partnerships with the CFCEs, having those opportunities to connect across, all of the early childhood systems is a wonderful thing. Um, we've been trying it for a long time, and we're still trying it. So
Right. Thanks. Back to the chat. Thank you, Pat, for all you do for families with children with disabilities. The conference is always my favorite. Do you still host?
yes, the VOC still happens every year. We have been doing it remotely since COVID, but we're hoping to have in-person events. We tried a Western event in the Amherst, and we did it in English and in Spanish. It was well received, poorly attended, but well received. And we were down on the Cape and had a lovely time at the Bourne Middle School. Again, great resources, great vendors, great exhibits, not great attendance, but we're still going to try. And so we're looking at a spot out in Central Mass to have something next May. And so keep your eye out. But the Visions of Community is always the first Saturday in March, and it will be available. CEUs are available for early childhood folks, and scholarships are available. I happen to be the one in charge of scholarships, so contact me. And so I do a little bit of everything. And so, but I'm looking forward, and we always have an early childhood strand to VOC. We always have a health strand for those kids with special health care needs. And and as well as moving up through the ages transition. And we have a youth conference, which will be on the same day in May as our in-person, um, to help transition out to adult services. So again, the Federation works across the ages. And so we are very excited to keep our, hold on early childhood. I happen to be the Massachusetts ambassador for the DEC, which is the Division of Early Childhood Recommended Practices. And so can help connect programs with those recommended practices, which they have fabulous resources, which are all available for free um, through the Division of Early Childhood. And so we can make those connections as well.
Pat, we can't help you enough. As you were talking, I'm thinking of all these different ways we can better integrate the early childhood agenda and your expertise. It's just been incredible to find all the information, and we would love to have you come back maybe on a regular basis. This is a topic that comes up, and you are such an incredible resource, and your longevity doing this work, right? You know all the people, you know all the systems. I think I felt like a collective sigh of relief to hear you share the information in such a thoughtful and kind of comprehensive way. So we would love to have you come back. We'll post the slides. I will send you the chat so you can kind of see all the love notes from the fans. And just thank everybody. Everyone really appreciated this through the chat. It's easy to see. and we would love to have you back. And thanks, Titus, for your intro. Titus also put a blurb in there from the work group. So you can take a minute to read that. But Pat, thank you so much for joining us this morning, and we hope to see you back here soon.
Happy to anytime. Thanks so
Great.
much.
Thank you. Okay, everybody, tomorrow's Wednesday. We'll see you back here on the 9:30 call. Have a great day.